Let me get started. Hello, welcome everybody to the Bridging Research and Practice Conference. I'm Catherine Faith with SHARE. This session is entitled Peers and Collegiate Substance Abuse. And our presenter is Dr. Noel Vest. He's a postdoctoral research fellow at Stanford University School of Medicine. His research interests lie at the intersection of mental health, substance use disorders, addiction recovery, and prison reentry. He received his PhD and master's degree in experimental psychology from Washington State University in Pullman, Washington. Just a reminder, all our sessions today are recorded, so you'll be able to review them at a later time. We'll share them with all of you. And just a mute reminder on Zoom during the presentation. And also, we ask that if you could please put your name, email, and organization in the chat, just for part of the PWI initiative and the grantees are required. We just want to make sure that there's attendance, and we're going to have an evaluation that we send out at the end of the day. Okay, thank you so much. And here's Dr. Noel.
Thank you very much. It is an absolute pleasure to be here. You know what? I'm going to actually add my Twitter handle, and so I'll put my information in the chat, and I would suggest other people maybe put their Twitter handles in there as well. I love to follow people on social media, and so I find that Twitter is a good way to get our research and just information out there in a somewhat professional way. And so I'll have my email at the end of the presentation for people to write down. And with that, I'm going to go ahead and start sharing screen. And then you can tell me whether or not this is coming. Oops, I got this backwards, don't I? There we go. Does that look right? Is it just my screen, not presentation
You're in
mode?
presentation mode.
Okay. And you can just see the screen. You can't see the next.
You can just see the
okay,
slide.
Perfect. Yep. Awesome. Thank you so much. I want to say thanks to the organizers of the conference. It's been really, really interesting thus far. Want to thank Catherine, our tech support here from SHARE, and just everyone that's attending this conference. I think it's just such a necessary thing as we move forward into this new world of trying to understand the disease of addiction. And so I'm really, really happy to be here. Again, please let's use social media as a tool to promote not just our research, but the work that we're doing. And so if you have anything that you'd like me to elevate on social media, specifically Twitter, please feel free to nudge me there. And like I say, I love using that platform to send out other people's research and just some really cool work that's being done, especially around peers in recovery. And so with that, I'll go ahead and get started. I do have funding disclosure. I'm currently supported by a T32 funding mechanism here at Stanford University. It's funded through the National Institute of Drug Abuse. It is a research grant that I am on here. I don't report any conflicts of interest. And so I'm going to start off with actually not talking about any kind of research or about collegiate recovery programs, but I'm going to talk a little bit about myself. One thing that I've always appreciated when I have listened to other people, other researchers, people that I aspire to be, is that what I'm finding is that they'll spend a little bit of time talking about how they got to their perspective on either substance use disorder or on recovery, or whatever that might be. And so I always try and take a minute or two just to kind of explain a little bit about my background, and so that you can kind of see where my perspective is, and some of the research questions that I ask are really shaped by this, by my lived experience. And so like I say, I want to talk a little bit about that. So my career in academia actually started through a college and prison program. I was due to some nefarious activities while I was in active addiction in my 20s, I ended up being sentenced to a fairly lengthy prison term. I ended up being sentenced to 7 years in the Nevada Department of Corrections. Luckily, they had some mutual support groups that were in this prison. I think the other really important thing for me was that they had a college and prison program. And so I was able to start my college training or my career in academia there, where I was, it really was very, very important to me because it really helped me kind of entrench some study skills that I was able to really take with me once I got out. And so some study habits that, because your day is very defined and very structured while you're in prison, it allows you to, like I say, set apart time to do studying and whatnot. And so it really helped me to kind of structure my day. At the same time, I was kind of learning and doing some self-reflection about my own addiction, and it was just a really enlightening time for me. And so when I got out, I knew that I wanted to try and become a drug and alcohol counselor. That was a pathway that I had heard to a career that people with incarceration histories could potentially attain. And so I immediately went into the local community college where I paroled to, which was Columbia Basin College. I ended up working for quite some time, about 4 years as a drug and alcohol counselor. I graduated from Columbia Basin in 2011. Luckily, at that time, I was also being not only mentored, but really inspired by other people that were at the school and some people that I was working with to go on and try and get my bachelor's degree. And so I transferred to, at that time, I transferred to kind of the next developmental stage of my academic career. I transferred to the Washington State University campus there, where I lived locally. I was still on parole, so I had to stay close to home. And so I transferred to Washington State University, Tri-Cities. And there I met who would become my person who would become my mentor, Dr. Sarah Trigg-Resser. She really got me involved in her research lab. And I just fell in love with the wonderful world of empirical evidence and science, and realized that was really the pathway that I was going to try and forge. I loved the work that I was doing as a drug and alcohol counselor, but it wasn't really my passion. I think I took too many biases that I had in my own work with me into the counseling room, and I just don't think I was a very effective counselor. And so, like I say, luckily I was at the same time I was being really challenged to go on and not only pursue a bachelor's degree, but also really challenged to apply to graduate school. And so as I was finishing my bachelor's degree at Washington State University, I applied to 7 different graduate programs, PhD programs. Of the 7, I was accepted to 1, to the main campus of Washington State University in Pullman, Washington. It was also the only school that I applied to that did not have the criminal history question on the box. And so for me, it was kind of like, it was very, very important. And again, I don't know if that's just a coincidence that happened. But I thought that it was pretty interesting that the only place I got into also didn't ask about those types of questions on their application. And so I entered into school at Washington State University, did my PhD program from 2014 to 2019, graduated in 2019 with a degree in experimental psychology. While I was there, I also started helped co-found a collegiate recovery program there called Cougs for Recovery, which is still going there at Washington State University. It was just such a great opportunity for me to kind of blend 2 things together, academic pursuits and then also being in recovery from substance use disorder. And then fast forward 2019, I'm looking for positions for a postdoc. Very, very fortunate to be interviewed and then eventually hired by the Stanford School of Medicine to work here with a gentleman named Keith Humphreys, who, for those that don't know, has really kind of written the book and literally written the book on research around mutual support groups, and is just an incredible mentor, an incredible writer, an incredible mentor. And then while I've been here too, I've also been involved in the group that is starting a collegiate recovery program here at Stanford, the advisory kind of group for that as well. And so I've really kind of been involved in a bunch of different aspects, but I do think that this kind of gives an idea of what kind of fuels my passion, and why I'm so adamant, or why I'm so interested in not only peer supports, but how addiction science, how we can bridge these gaps in between research and then what we know to be kind of happening in the real world. Okay, and so that's a little backdrop on my background and what kind of brings me to this work. I'll quickly run through the history of collegiate recovery programs, and then I'll talk a little bit about the history of the research on collegiate recovery programs. Basically, you have phases of how collegiate recovery kind of came into existence. You had the very first program being started back in 1977, so over 40 years ago, at Brown University. And then you had kind of this early work in collegiate recovery programs, spearheaded by Texas Tech, Rutgers, and Augsburg University. And so up until about 2000, these are the three main programs that you had kind of across the country, where everyone applied to and tried to get into. And then you had right in the early 2000s, we'll look at some of the research that came out, but you had a kind of an explosion of more programs because Kitty Harris and some people at Texas Tech put together, well, they did a lot of research, but then they also put together a curriculum to train into schools, or to provide kind of a step-by-step guide to schools on how to start a collegiate recovery program. And so you had kind of this explosion up until about 2013-ish, from 3 programs to 29 programs. And then similarly, another kind of expansion or explosion in programs happened in 2014, because you had the Stacey Mathewson Foundation, which is today Transforming Youth Recovery. They provided these seed grants to really any school that applied for them. So these $10,000 seed grants to start a collegiate recovery program at really any university. And so you had, again, this explosion to from 29 programs back in 2013 to upwards of probably over at least 140 programs, probably many more that are operating today. And so we have 140 programs, but there really is very little research to guide them. I'll talk about just 3 of the kind of pinnacle research projects that have been done. There are others as well, but not, and we'll talk about this in a minute, but not a whole lot of funded research. And so this was kind of the beginning of the research trajectory in collegiate recovery programs. Kitty Harris, pictured here, and then Bo Cleveland did a really great job in the early, from 2000 to 2010, basically kind of creating all of this research. This is one of the publications that they had. They also ended up publishing a book about substance abuse recovery in college. They published that, I believe it was in 2010. It's a great book. It's a little bit outdated now, but it really helped to kind of fortify and create some evidence base around these collegiate recovery programs. And then next, you had a funded research program by a woman named Dr. Alexandra Lade. She did a lot of research. Her funded project through NIDA kind of examined these 29 collegiate recovery programs that were in existence at that time, and really kind of gave a broad overview of what was happening. And since then, there has been no funded programming around collegiate recovery, at least not through NIDA or NIAAA, around specifically collegiate recovery. And so recently, both myself and some researchers here at Stanford and at the VA and at Harvard, we recently wrote a scoping review just to kind of talk about the state of affairs and where we're at right now. And so as I was writing this, I really kind of came up with the idea of what I'm going to talk about a little bit later on after I kind of lay the foundation. But I really started thinking about this idea that we really needed a framework to work from in understanding collegiate recovery programs, because what I was learning was that there were so many moving parts. And if one cog in the wheel was not being lubricated, then it really created this situation where you could have a kind of a it just didn't run very smoothly. And so understanding all of these kinds of variables that can play into how collegiate recovery program how a specific collegiate recovery program is working was going to be very important kind of moving forward. And so again, this was just kind of a result of this scoping review, and I'll get to that here in just a moment. So the first thing that I want to do, I think that this is really fairly interesting. I do this because it's something that it's a research project that pretty much everyone on this call can do. This is not scientific at all, but I love to do this every once in a while when I'm trying to figure out how much research in an area there is. And so I'm sure that many people on this call have maybe logged into Google Scholar, maybe to try and find some kind of research or something to support a point that they're trying to make, maybe in a presentation or to a funder or to an administrator. And so I want to talk a little bit about the research on collegiate recovery programs, or just in college students in general in recovery. And so again, this is not scientific by any means, but I do think it is very telling in terms of the priorities of not only schools and foundations and states, but also national funding agencies. So this is again something that everyone could do. If you even wanted to open up another screen, you could do this right now. But so in Google Scholar, you basically, just like Google, you put in your search terms that you're looking for. And so if you were to put in these words, right? So substance use, college students, blank. And so the first blank would be prevention, the second blank would be treatment, and the second blank, or the third blank, would be recovery, right? And if anyone is familiar with the continuum of care, this is kind of how the pots of money work with funding these different areas, is that you have kind of the continuum of care for prevention of a disease, of treatment of a disease, and then recovery of a disease, right? And so when we look at college students and prevention, this is the return that we get. This is how many articles Google Scholar says are out there. So 1.17 million potential articles on collegiate recovery or on prevention of substance use in college students. Then we take that out, so erase that out, and then you put in treatment. Much more returns. This makes sense, right? There's a lot of articles, scholarly articles out there on treatment. But then we put into the Google search college use or substance use college students recovery in the blank, and this is what we get: a much smaller amount. And if this were any other disease, right? If this were cancer, or this were any kind of other disease, we wouldn't see this type of disparity. So this is really, I think, this is part of a larger problem where recovery of this specific disease does not get the respect that it deserves, right? And so what I see is that you have these very large colleges, these very large universities that are all benefiting from research on prevention and treatment and recovery, but they're not investing. They're not investing in their own students. First of all, their own students in recovery, but they're also not investing in that recovery phase of treatment. And that's really, it's almost like a three-legged stool, right? If you have these legs of prevention, treatment, and recovery, you can have the best treatment in the world, but if you don't have that third leg of research and understanding of the recovery side of things, that stool is always going to fall out, or so it's really, really important that we make sure that we're funding recovery. And so I'll get off my soapbox here for just a moment, but that is very, very important. So funding should be tied to all substance use disorder research. Okay, so that's something that you can kind of try on your own. This, again, for people that are familiar with the continuum of care of substance use disorder, you can see that this, kind of what I just showed, where the investment in at least research funding, it looks like, is very, very much so in these early intervention efforts, and then in the treatment, but again, not so much on recovery. And so in the next slide, I'm going to talk a little bit about an analogy for kind of research around substance use disorder, and talk about a little bit about an analogy for how we treat addiction really in this country right now. And so this is actually not something that I came up with. This is something that a researcher that I very, very strongly admire, a gentleman named John Kelly at Harvard University. He came up with this burning building analogy. And I think that it really does hold true, right? We think of addiction as kind of this burning building where, a person's life is kind of, on, for lack of a better term, is kind of on fire, and they're really, really struggling to to not only get into treatment, but all of the things that everyone on this call is very, very familiar with, right? And so if you think of addiction as this burning building analogy, I think that 50 years of research, we've done some good things, and then I would say we've done some not so good things. I think one of the good things that we've done is this acute clinical pathology, right? We're very good. I shouldn't say we're very good. We're decent at getting people into treatment that need treatment, and I think that's arguable, but putting out the fire, right? We're good at doing that. The next thing is that there's been a lot of research, and again, I don't know if we're good at it, but I would say that there's a lot of research around relapse prevention. So maybe preventing the reignition of those flames. But then we get into some more of the important work for kind of the aftermath of addiction, right? And so when we think about when a person is rebuilding their life after the fire, there's a lot of architectural planning that needs to go into that that building. There's a lot of new building materials that need to be sought out for a person kind of entering into recovery, and then there's also building permits and things like that need to be soothed over with the city or the state or whoever it may be. And so you can think of these three things as are we doing a good job of recovery planning? Are we doing a great job of kind of increasing recovery capital? And then are we removing some of these barriers that limit people with histories of addiction from either getting jobs or going back to school, or whatever that may look like? And so again, I think that research has really focused on these two areas and not really focused too much on these areas. And again, so kind of going back to our continuum of care, we've done a good job kind of in understanding somewhat what these treatment areas are, but we have a lot of work to do, I think, in understanding how recovery support for the disease of addiction really works. And so this is where we kind of bring in the Collegiate Recovery Program. I believe that the Collegiate Recovery programs are really just they are a part of the recovery-oriented systems of care model, right? And so I think they fit in nicely with recovery high schools. I think they fit in nicely with what are called recovery cafes out here on the West Coast, and called recovery community centers, I think more so on the East Coast. But kind of these community centers that are available for people in recovery, and that looks like a whole host of different things. But I think that they fall under this recovery-oriented systems of care model. And I think the things that they add to recovery is that they can help with this recovery planning. They can add to a person's recovery capital, and then they can hopefully remove some of these barriers that we know are important to be moved. at the not only at the school level, but hopefully even at the state level. I don't want to spend a whole lot of time on this slide. I think that this just gets into George Koob's model. It's a neuroscience model. I'll just say that we're really kind of focusing on this preoccupation anticipation area of kind of this loop that he's created on hyperkatifia. If anyone is interested in this article, feel free to reach out to me and I'll send it to you. But again, just kind of focusing on this particular part of this loop that he talks about. I do think I will spend just a second talking about this. This is another article by Bettina Hepner and John Kelly from a couple of years ago. And I do think it's really important to just kind of understand when we kind of talk about, and again, you know, I think people's definition of recovery is different kind of depending on their context. But when we talk about, you know, remission from substance use disorder, you know, longer remissions result in greater accrual of this idea of recovery capital, right? So these contextual things that are supportive of a person's recovery. So environmental things that are important in a person's recovery. And we see that greater recovery capital increases the chances of long-term remission because it reduces behavioral stress, which is a major pathway to relapse. So this idea of SUD remission, this is a bi-directional relationship, right? Where increases in recovery capital can really influence the chances of a person entering or having a remission or having a recurrence of the substance use disorder. And so this idea of providing more recovery support will increase the chances by reducing these stresses that we are known to kind of happen in a person's recovery. And then again, this slide just kind of talks about the research that was done a while ago that shows that it takes anywhere from 0 to 17 years for a person to enter into long-term recovery. And the idea here is that collegiate recovery programs recovery community centers, in general, these recovery-oriented systems of care can ideally shrink this time frame, and this can be done through contexts or environments that allow for the accumulation of recovery capital. And I think that's really what collegiate recovery programs can offer. And so when we think about recovery, this is, I think, a lot of times what people will think about when they think about recovery from substance use disorder as it relates to collegiate recovery programs. But I think that it's even more than this, right? So if we think it's this straight line from just having a collegiate recovery program that leads to remission and enhanced quality of life, but it's actually, you know, it's a little bit more convoluted in that you have this idea of kind of increasing recovery capital so that these biopsychosocial changes that happen in recovery can then lead to remission and enhanced quality of life. And so this is really, and I'm sure many people on this call have seen this really just kind of falls right into this idea of the biopsychosocial model of substance use disorder in general, where you have the influence of biological, both genetic and then exposures. You have kind of some psychological influence, but a large part of it is this social influence of substance use disorder. And so again, fits right into this biopsychosocial model of substance use disorder. Okay, so I've talked a lot about the backdrop for what I'm going to talk about next, because I'm going to introduce a socio-ecological model of substance use disorder as it relates to collegiate recovery programs, because I think it's really, really important that we have a framework or a language that we can talk about or agree on when we're talking about collegiate recovery program. And this will allow us to kind of have that same language. And so I'm going to talk about the three programs that I brought up earlier, because I think that they're very easy to talk about, and I think they just provide enough information for the point that I'm trying to make here. So when we look at these three programs, we try and decide, so what does a collegiate recovery program look like? So let's take, for example, Texas Tech University, right? Very, very established program. This is a public university with 3,300 undergrad students. They have over 100 students in their collegiate recovery program, millions of endowed philanthropic funding dollars to fund their program, so they're not contingent on state level funding at all. Well, I shouldn't say at all, but a lot of their funding is through philanthropic means, and it's endowed, so that means that it's fundable every single year. They have a very large staff, and they have housing and financial aid services for students in recovery. Probably the most well-established program in the country. And then let's take a school like Rutgers University, right? So again, a public university, very, very large student base, almost 50,000 undergraduate students. They also have recovery housing. They don't have the kind of philanthropic funding that Texas Tech has, but they have the budget for Rutgers. The overall budget for the entire university is $4.4 billion that they receive from the state in funding. So again, a very large funding mechanism, though not all going, not even probably even a very, very small amount going to collegiate recovery program. And so then let's take Augsburg University, private university. They require an application process to get in their collegiate recovery program. They have 3,000 undergraduate students, and the entire budget for the school is $109 million. So you can imagine that these programs look completely different. And you know, if you're doing research on these programs, you're going to have to take into account these contextual factors that play into the you know, quote unquote success or failure of a program. And so or students in the program. And so this doesn't even take into account, you know, smaller schools with no funding and no infrastructure to support a collegiate recovery program. But the bottom line here is that it makes sharing information across institutions difficult because we don't have a framework or a language to work from. And so the goal of this project really was to provide this comprehensive framework to better understand collegiate recovery programming and then the students that they serve. And so with that, what I have worked on here is what I call the socio-ecological model of collegiate recovery programs. And so anyone that has seen socio-ecological models, this should be very, very familiar. This idea that we have factors at the individual level, the interpersonal level, the organizational level, and then at the policy level. If anyone is not familiar with this, again, you feel free to reach out to me. This Bronfenbrenner study from 2014 really lays out kind of the importance of these things and talks about how understanding any kind of organization through this socio-ecological model can be beneficial. And so I'll go through these kind of individually and then talk about what this looks like here at Stanford University. And so I'll use the example of kind of what we have here at Stanford when I get to the school and organizational portion of this. And so when we think about factors that are going to be important at the individual level, this is, you know, fairly, you know, I would say this is going to be across programs. These are going to be things that are very common to all of these programs. So this is basically anything that the person brings to the equation. So whether it's biological or age of first use or grades or personality, all of these things that are important to that or factors that play into that person's recovery at the individual level. And then we move on to the interpersonal level, right? So this can be a whole host of different things, but these are basically first level factors that have a role in SUD, substance use disorder development and recovery, right? And so whether the person, whether the student is has some of these indirect supports, whether they're, you know, whether that's family or whether that's peers or whether that person is maybe involved with the criminal justice system previously, potentially well-being of that student. These are things that, again, are kind of at that interpersonal level, not biological factors, but things that are in that person's kind of direct surroundings or indirect surroundings. Okay, and then we move on to the school or organizational level, right? And so this can be a whole host of different things. I've just listed a couple of different things here. So it can be the type and level of funding that the school and the Collegiate Recovery Program has. This could be sober activities that the school sponsors. This can be campus housing. Do they offer either substance-free or recovery housing? This can be, do they have a student drop-in center where any student can drop in, learn more about recovery from someone in recovery, a peer in recovery? This can be staff size, which may be important, and this may be administration, the support of the college's administration as well. And so I'll talk a little bit about what that looks like here at Stanford. For those that you don't know, Stanford is very much so a private school. The Collegiate Recovery Program is actually alumni funded. We had one alumni that funded the program a couple of years ago. We don't have a student drop-in center. We do have substance-free housing, which just opened at the start of this year, which has been absolutely incredible. We have sober activities as a priority here, something called Cardinal Nights, which has been in effect for really over 20 years here. And then we do have really great space for mutual support meetings, any kind of self-help meetings. And so what started in 2019 here as a student group has really had strong growth ever since. And so these are just a couple of pictures highlighting some of the work. This is some of the sober activities that we do. It was a pumpkin. It was a pumpkin decorating night here that they had at the Well House. This is the recovery meeting space that they have. This is a picture of the substance-free housing unit here at Stanford. It's called the Well House. It houses 51 students that sign a contract to be substance-free, and it really is just an incredible building. It's an incredible space, and very, very lucky to have it here. And then these are some of the individuals in recovery celebrating 2 years in recovery here. And so again, this is just the context of one small private university here in California. You can imagine that there are different ones, different contexts at many other universities that have different levels of funding, different resources, and then in a different environmental context. And then you can imagine that policy, kind of the level above the school and organization, is going to be important as well, whether that's state funding for recovery services, transition services, whether your state is a Medicaid expansion state, whether there are regulations, whether there are laws. So state level funding for recovery, I would say, is not very good here in California. But one thing that is very important is that a couple of years ago, we banned the box on college applications. So that's taken away that barrier for individuals that are applying to school that may have had problems or issues with the criminal justice system as part of their recovery process. And so one huge barrier that was removed was that ban the box in higher education. And so another thing that's important to remember is that these are not just things that move in one direction, right? So you have to kind of understand that each one of these levels is important to the other level. So these are actually bi-directional, that in that, just even understanding one or how one influences the other doesn't really tell the whole picture. And so these relationships between these different levels are going to be bi-directional. And so it's really, really important. So if we had, let's say, an outcome like we were interested in, right? We're doing research and we're interested in an outcome like relapse or quality of life or depression, we would need to understand that it happens within these contexts and not in a vacuum. And we need to make sure that we're, modeling our research or our statistics so that it takes into account some of these things that we know would be important for truly understanding this particular collegiate recovery program, but then also understanding research kind of on a larger level. And so I think that this socio-ecological model is really, really important because it brings in, this idea that we can share knowledge across institutions, we can improve outcomes, we can disseminate this widely, and we can implement these findings. And ideally, all of this is to affect policy change down the road. And then lastly, I think that collegiate recovery programs play such a large role in shaping the addiction crisis, shaping what we do in this country around recovery, because I think the long-term effects of having collegiate recovery programs is that we help to reduce stigma on campus and in society. And so higher education, post-secondary education is training tomorrow's leaders, and we need to make sure that we have a strong representation of individuals with lived experience of addiction in those classrooms, so that people in college, other students in college know that this doesn't just happen up in the Tenderloin here. Addiction doesn't just happen up in the Tenderloin here in San Francisco. It happens amongst their peers. It happens to individuals that they call friends and the people sitting next to them in the classroom. When that puts a real face on addiction, it trains these leaders to realize that addiction is kind of happening around them, which I think is very important as we move forward. And with that, I am done with the presentation part of this, and so I will take myself off of sharing and open it up to any questions. And I realize now that my information was not in my email address was not in the presentation, so I will put it now in the chat for anyone that wants to either follow up with me or whatnot. So we're at about 10:56 p.m. That gives us about 20 minutes for question and answer. I have to get out of here right at 11:15. I have another presentation. But with that, I want to say thank you to everyone, and then open it up for either comment or question or thoughts or anything that people want to discuss here.
I have a question. My name is Raquel Ship from the Sacramento Youth Center. So we support high school students and transitional aged youth, hoping that some of them will find their way to college one day or a career that they can be engaged in for years to come. One of my questions is, as you're seeing incoming freshmen who may already have been exposed to substance use disorder or behavior, how do we as an organization kind of prepare them for maybe just the opportunities that these colleges have? Are they calling themselves substance use? Because I don't know if I want to initially like just present, hey, it seems like you're struggling, let's get you into a program right away. But is there a negative connotation of getting into these programs like right off the bat for students? Do you feel like there's any apprehension of accessing these services? How do we just bridge the gap from maybe a high school experience to college and prepare them?
Yeah, well, that's a great question, and thank you so much for the work that you're doing. I mean, that's incredible. And I think that one thing that has always been important to me is, and there was a presentation a couple of years ago up at Washington State University where it was basically a kind of bringing together a recovery high school and a collegiate recovery program, because I think I truly believe that bridging that gap, making sure that we can transition people from recovery high school to a collegiate recovery program is vital for just that continuation of their education, right? And so what I generally see, and this is just kind of me personally, what I generally see is that there are a couple of different kind of like developmental patterns that I see in collegiate recovery programs of the students. So you have kind of, there are definitely, I would say, a smaller portion of individuals that come from recovery high schools. And a lot of times what I see is those people identified right away in the collegiate recovery program. Like they want to be around their people, they want to understand recovery, and they really want that community of people in recovery. And then there are students that run into problems while they're in college, and they go away to treatment and then they come back. I'd say that that's probably about, in my experience, it's about 30% of the students that we see. And for those individuals, I would say it's very much so like what you're talking about, a little trepidatious. They respect and really want their anonymity, and especially early on, really kind of afraid of letting their peers know that they're in recovery, but they don't want to use, they know they don't want to use, but they want to, they want to take it slowly. And then I would say the last developmental trajectory of the students I see in collegiate recovery programs, which is about 40 to 50%, are students that are coming back to school, right? So they've maybe gone off, had some criminal justice issues, and they come back to school at a later age. Those people identify right into the collegiate recovery program, are kind of, I would say all age groups are really, really important. And so I think that, as far as kind of your original question, I know I've kind of gone off path a little bit, but your original question, I think having individuals from collegiate recovery programs come back and talk to the students in these recovery high schools is vital, right? Because all of these people have taken that path, right? We have students here at Stanford that have been justice involved, have been, there's just a whole host. And so going back and just, talking to students in these recovery high schools is so important. So I think it's a kind of a joint effort to kind of inspire and then let people know that this pathway to higher education is possible.
That is really good advice. Thank you. I will take that. Thanks.
Yeah. And, Sacramento State University, definitely, I know that they have, I'm pretty aware that they have some kind of collegiate recovery program that might be one to reach out to. It looks like, is it Deanna Allen?
Sorry, trying to unmute myself and looked how to put my hand down because I always forget that part. So remind me.
Story of our lives.
I've been working, we had a B Corps, which was under the CARA SAMHSA grant for 3 years, and utilized that with, my statewide development for part of our data. And so working pretty intensely with several Cal universities and a tri-county collaborative that covers San Diego, Orange County, Los Angeles, and then we have Riverside and San Bernardino that are all part of the conversation. And I've advocated for a recovery community center at multiple universities, and even have pitched with student-led, which could really be a Faces and Voices RCO, a peer-led board of an organization to make sure that these exact models are available across Cal universities. I, even had the organization of all the deans of the colleges together. I think it was the chancellors kind of located in Central California that wanted to hear it, but I didn't want to get in so deep. That would kind of be a part of what we do, but the vision is definitely there, especially at, UCLA, USC. And so I'm just open to continued leadership and ideas that could help us to do this type of community development at our universities, because that's not really the realm where I camp out. Community development and incorporating, these peer-led services across our state is. So if I could pitch questions, I think with your permission, I'm going to take this playback and show it, to my professor of social work at USC, and say, I'd love to use this kind of as a platform to continue the conversation that we've said that they're necessary. And of course, there are evidence-based models or, promising practices at a minimum. And so I'd love to just stay in contact with you. We are under PWI and SoCal development. We have a 5th, 6th, and 7th cohort in SoCal. So this is going to continue to bring the university's peers to the table who absolutely are tired of watching students die, alone, isolated, and not wanting to take time out of their collegiate journey in their life for treatment. It doesn't work. We just continue to go around and around and around with treatment. And we know that recovery works and together we can. So any help that I could get in that, I mean, the potential, the groundwork, the conversation is already not even just a seed in the ground. It's got some pretty amazing roots. And I would love to see at the end of, PWI that we've got a university that has an RCC or a recovery cafe. Start that pilot and keep it going.
Yeah, well, my email's in the chat, so feel free to reach out to me. I'd love to follow up with you on that. I think
Thank
another one that
you.
I would check out too is Angie Bryan at UC Santa Barbara has just an incredible program as well. I want to also, I'll call on you in just a second, Catalina. I do want to say one of the co-authors on the paper is that we wrote on this is actually in the audience. So Sierra Castedo, I'm going to screw your name up, Casteda de Martel is a co-author on this paper. And so I wanted to thank her for all of her work on this paper as well. We hope it gets published here very, very soon. But shout out to her and the work that she's done on this. Catalina, did you have a question?
Hi, Catalina with Central California LGBT Collaborative. So question being, trying to begin or start or reach out to the LGBT kind of like aspect of recovery or people who are in addiction within the LGBT community. What are some ways that you guys have seen worked just reaching out to the LGBT community, or is that still kind of an issue? Because what we realize a lot is, number one, dealing with just in the closet or coming out, or no support from family, or transitioning issues that a lot of times leads up to addiction, just because it's so difficult to find support itself. But what are some ways, and then also going through school and all that is a big thing as well. What are some ways or some things that you've done, or if you can lead me to, that we can reach out to or start within our own community here?
Well, that's a great question. It's such a I mean, I hate to even try and answer it in this, small of a space, because it deserves such a grander answer than I'm going to give you right here. It's, I think that collegiate recovery, I think that, individuals in recovery, I think that recovery organizations in general, are all trying to learn as much as we can about how to, have these programs that are inclusive just across the board. I think that in general, and this is just, again, I'm going to speak in generalities that I've seen at collegiate recovery programs in general. I think that universities themselves, for the most part, again, I don't know this to be true of all universities, but the universities that I've been at have been very supportive of LGBTQ communities. They have been they have programming that is very receptive, and I would say in the two places that I've been, and especially here at Stanford, I would say 50% of the students that we have in recovery, right around in there, identify LGBTQI as LGBTQI. The program here, the student that started this program is, and so or at least identifies in that way. And so I think that we've been really, really lucky that it's kind of organically been created by students that identify there. And so it's just from the very beginning, the idea and the supports around being very inclusive, have just always kind of taken center stage. And so again, I know I've been really lucky in that here. I think that, being in the Bay Area as well, just, we have a community here that I think is different than other places. And so I don't want to like say that that's going to be true of anywhere you go, but that's been my experience here. And I think that it's just so important for all of the reasons that you mentioned. And I think that as we move forward, we're going to see hopefully down the road, some really cool research around this as well, because I do think that it is, yeah, I mean, you brought up a very important topic. And again, I don't have a great answer for you, and it deserves so much more, but that's kind of what I'll say there.
Thank you. Thank you.
I don't know. I couldn't explain that, to be honest.
I just wanted to share something.
Sure.
This is Kathy Long, and I'm with an organization called Teens for Teens Help. And we're new and we're peer-based, and it's a website based on stories of recovery. And our age group is from really 13 to 25. So our goal is, as we build out, to have a significant piece of that puzzle being college students, and dealing with everything that they're going through, addiction, as well as other mental health issues, anxiety, depression, self-harm, kind of the whole thing. And the website is based knowing that these peer stories of recovery can lead to someone else getting help, hopefully sooner. And by hearing what other people have been through, they can then learn from other people's mistakes, really, and reach out for help sooner. And it's also got informational videos about the topics, and then a ton of resources. And it's all university based. We're working with USC and UCSF. And so I just wanted you guys to know that it's there. And hopefully, as we expand, I can reach out to Noel and some other college people on campuses to figure out how we can really spread the word and get the information out, garner more stories of recovery from that age group, so that it can just be the source that we envision it to be, for people to know that they're not alone, others have been through it, and that there's a way out and a way to get help.
Yeah, so thank you so much for the work that you're doing. That's incredible. I put a link to the website in the chat. People can kind of feel free to open that. I'm going to put another one too. There's actually another similar organization started by a former student here at Stanford, Mercy Bell, called Sober Voices, that is fairly similar and does some of the same things. And you're absolutely right. I mean, I know that. Oops, I didn't mean to do that. It looks like I sent them as direct messages. I sent both of them as direct messages. Let me get it so that I send it to everyone in the meeting. So there's that one, and I'll put this one in there as well. It's just such an important thing. I know that, speaking for myself, coming out of prison, I was, destitute. I was at the end of the, I didn't think I had any chance ever of any kind of career, and I was very worried that I would return to a life of crime, and knew that I didn't want to. But it was stories. It was individuals that had had the journey, reading a lot of memoirs from people, then learning from some of my peers that were entering into graduate school. That though the box on the application is it can be a barrier, there are schools out there that are accepting people. Just hearing these stories really inspired me and kept me going and motivated me. And so websites like these are just vital for people looking for a solution. So thank you for that work. I hope that people will look at these websites and see how they can incorporate it into the work that they're doing. All right, well, we're about down to 11:13. I have another call at 11:15 that I have to get to. I do want to just start off by saying thank you so much for everyone that joined today. Really, really, I mean, it's just so awesome. I think this conference is so cool because we just get to hear and see, some of the great work that's not just happening here in California, but kind of across the country, and tapping into that, and just knowing, hey, I'm not alone in this world, and this work that I'm doing, that there's other people that are struggling and really understanding my fight. I think it's so, so cool. And so that this conference is happening and we're able to share these experiences, just so cool. I want to say again, a really quick shout out to Catherine, who was the tech support on this. Great job. Thanks for helping me, share my screen and everything that's involved there. And again, thanks to the conference and everyone that showed up today. Thank you so much.
Thank you so much, Dr. Noel. We're glad you're here.